Breast augmentation remains one of the most popular cosmetic procedures in the United States. I'm Dr. Tiffany McCormack, a board-certified plastic surgeon at Reno, Tahoe Plastic Surgery, one of the world's leading clinics. Today, I'm going to walk you through breast augmentation, what it is, who it's for, and what you can expect during and after surgery. So what is a breast augmentation? Typically, it's a method to enhance the volume of your breasts, whether that's with fat or an implant. It also corrects asymmetry or volume changes after weight loss or pregnancy. If you were born with small breast or asymmetric breast, we can correct that with augmentation as well. So how long does the surgery take? Breast augmentation is typically an outpatient surgery, which means you go home the same day. It typically lasts 1 to 1.5 hours, and most patients are under general anesthesia. Before surgery, I like to meet with my patients in consultation. During that time, I like to review the recovery process with them and what to expect during and after surgery. We also spend a considerable amount of time sizing because that's really what most patients find most important. We use the Vectra imager to show them what their chest looks like currently and what it will look like with different sizes and shapes and brands of implants. We also do physical sizing in front of a mirror to really get an idea of what that outcome might be. The day of surgery, you'll meet with your surgeon one more time, typically to make markings on the chest, go over the plan, and discuss again maybe what that size is that you're looking for. During surgery, a small incision is made either around the areola, under the breast, or sometimes through the armpit. The surgery typically lasts 1 to 1.5 hours and is typically performed under general anesthesia. Most patients will wake up with a compression bra in place, and after they wake up and are fully recovered from anesthesia, will be discharged home with a caregiver. After surgery, it's really common to feel a heaviness or tightness or soreness in the chest. That's usually relieved with medications and usually resolves within a few days. It's really important to follow your surgeon's instructions after recovery to avoid any kind of complications. Let's talk about recovery with breast augmentation. If you have a desk job, I would expect 3 to 7 days off work. If you have a job that's a little more intense and involves more physical activity, we might recommend more time. I don't recommend any heavy lifting or strenuous exercise for 4 to 6 weeks after surgery, and you can expect to wear a compression bra during that time. So how long do breast implants last? That's a really common question in my practice. I tell patients no medical device lasts forever. As implants get old, they get a little bit weaker and easier to rupture over time. So at 10 years, you don't necessarily have to have your implants replaced if they're doing well and you're having them monitored regularly by ultrasound or other types of imaging. However, I tell my patients don't wait 20 years because at that point, the implants have become very weak and very easy to rupture, and it's much easier to replace an implant without any complication in place or without any kind of rupture. It's a much quicker and easier surgery to recover from. If you're thinking about breast augmentation, it's important to talk to a board-certified plastic surgeon. It's great to get a consultation and really go over what all of your options are to help achieve your goals. To learn more about breast augmentation, visit worldsleadingclinics.com.